Greetings. This is the coronavirus COVID-19 update for 3/4/2020. As usual, we'll start with the Baidu numbers. Baidu is a Chinese search engine, and they have a page set up to track the virus. This is the first thing you see on the page is this chart, and you scroll down, you can see some other useful information. The most important number on here is the cumulative diagnosis, 80,565, and that's up 143 from the day before. Cumulative cures is actually cumulative recoveries, and that's at 52,000. Suspected cases only up 143 from yesterday at 522. Severe cases, which is basically ICU cases, intensive care unit, 5,952, and the deaths have reached 3,000, up 31 from yesterday. Then as you scroll down, you see this map, which doesn't really change much every day. And if you scroll down further, you see the first graph. This plots deaths in black, added cures, which is recoveries at 2195. So you see that blue line is trending upward, generally trending upward. Suspected cases is trending downward, and so is new diagnosis, and that's at 143, which that keeps getting lower, and that's a good thing too. Then the second graph below that, it just plots non-Hubei province against and Hubei province against the national number, which is in red. And you can see Hubei closely follows the national number because that's the epicenter, that's where everything is happening. Then if you scroll down, you see that Hubei has 134 new cases, 131 of those is in Wuhan. And if you scroll down further, you see some search topics for today. So these are actually the top stories, and what you see here displayed is the search criteria or the terms. So sometimes the terms don't make a whole lot of sense, but the stories do. So we'll take a look at 6 of these today. That's a lot. So the first story is that the Medical Commission, National Health and Medical Commission, released the 7th edition or 7th version of the Diagnosis and Treatment Plan. And it's just they keep updating this plan, and one thing that they added here was the testing of fecal urine pollution. So that's not as important as them being on the 7th plan, and there were other things in here, but they keep updating their plan. It'd be nice if every country did that. Then the upper right is a study done after some Chinese prisons popped up with some coronavirus patients, and they studied that and decided that 11 people were infected by police returning to Shandong. Sometimes police were transporting prisoners, and that's how the infection started. And then lower right, this is news coming out today that made the international news, is that Chinese scientists have identified 2 subtypes, and one of these, the newer subtype, is more infectious. So that's not good news. And the 4th story, South Korean research team announces discovery of new crown virus antibodies, and these antibodies actually have been around for a while, but they found that they are effective with the coronavirus. They're from MERS and SARS. So those are 2 things that are proving to be effective in laboratories anyway. The 5th story, Swiss congresswoman kicked out of a conference for wearing a mask, and the bottom left, Singaporean student beat up in the UK. You debated whether that's newsworthy or not, but it just shows that there's still some people in the world that are holding Chinese-looking people as being responsible for all this. Then we take a look at the Johns Hopkins. This is the a research institute at Johns Hopkins that puts this stuff together, and this is a really good source for the global picture of coronavirus. And we saw yesterday, a bunch of Germans meeting in a room, the German Health Administration, and they have this same Johns Hopkins thing on a huge screen in the background. So right now we have 80,272 cases in mainland China and a total confirmed of 95,125 cases worldwide, 3,254 deaths. So the first thing I do is take a look at the mainland China number and compare it with the Chinese numbers that came out today. 80,565, and we're showing 80,272 in Johns Hopkins, so we're behind a few hundred there. So that 95,000 is still 95,000, but 95,400 something. Then I take a look at the three big hotspots. So South Korea went from 5,186 to 5,600, up quite a bit. Italy also up quite a bit from 2,500 cases yesterday to 3,089. In Iran also up quite a bit from 2,300 total cases to 2,922. And you can also see the deaths on the right side. So these, Italy, Iran, and South Korea, as far as deaths go, that's the highest number, outside of Hubei province in China. And that includes other huge cities in China and, huge provinces in China. So that's pretty alarming that Italy and Iran and South Korea have made its way up the list on the number of deaths. So I start out with South Korea. So the big news coming out of South Korea is the discovery of these antibodies that are apparently effective against the new COVID-19. They're the MERS and SARS antibodies. Then lower left you see that's 516 new cases, is actually more than that. And on the right, both of these photos show taking pictures of taking swabs of the inside of someone's mouth. Now, what do you do with that? And does the United States do that? No, because we're not smart enough. So this is a pretty fast test that you can give to people in, mass quantities of people at a time. It takes a little while to see the reaction, but we'll go over that a little bit later. And in Italy, the news is that the death toll just keeps going up, and Italy still doesn't know how coronavirus came into the country, but they know that the epicenter is in the northern provinces, and you can see those on the graph on the lower left, where 3 provinces and actually just mostly one, which makes up their red zone, accounts for nearly all the cases in Italy. And then you see Italy, the big announcement today was that shutting down all schools and universities. So that's good news. So what's surprising out of Iran, other than being close to 3,000 cases now, is the number of public officials that are coming down with coronavirus. It started a week ago with the Minister of Health, wiping his brow in a news conference, not a news conference, an announcement. He was standing next to somebody else, and he was obviously sick then. The next day he announced that he has coronavirus. Now we have 23 members of Iran's parliament confirm cases, and Iranian trade minister tests positive. And this all started with, these are from previous videos where we discussed this, but it all started with a pilgrimage to a religious site in Iran where the government was coming out and saying, we're not going to discourage people from going to this pilgrimage. And people went there, and they stayed in hostels where they were sleeping in beds next to each other and on top of each other, and eating at the same places in the hostel, and gathering together in really small confined places. And that's how this coronavirus started spreading anyway. So other than the 3 hotspots, I pick out other countries that I want to discuss. Japan, for some reason, Japan is still on the WHO list of their most concerned places. They naturally, the WHO is most concerned about South Korea, Italy, and Iran, but they always put Japan in that mix, and I'm not quite sure why. The Japan went from 293 to 331, and if you include the 706 that says others on the left, others is the cruise ship. So these all the passengers and crew have been disembarked from the cruise ship, and most have been repatriated back to their country, except for the people that are infected and they're in Japanese hospitals. And I just don't know what the concern is here. The numbers aren't growing that big for Japan. But anyways, news out of Japan today, upper left, advisory information. Some festivals and events have been canceled or postponed. Also, theme parks such as Tokyo Disneyland, Tokyo Disney Sea, Universal Studios, and museums and galleries are temporarily closed. Then we have Abe reaches across the aisle for emergency law, which means probably going to another party, which is something you can do if you don't have a dysfunctional government like the United States. And then Japan, a pharma company, says it's developing a COVID-19 drug. Well, yes, everybody else says, but so far we don't have much. Then France, the news out of France today. Evangelical service in eastern France is a center of a new outbreak, and this is from Lent. This is just a big get together, for Lent, and some people popped up positive from this gathering. So that's a new center, they say, a new hotspot. And they also published a map of France's areas that are most affected in the darker colors. Then the news out of Germany today. Germany going up from 196 to 262. That's a pretty healthy increase. The health minister of Germany announces that coronavirus, in his opinion, is a worldwide pandemic. Hasn't been announced that the WHO doesn't feel the same yet, but that's what he feels. Upper right, what some employers are doing to reduce risk for workers, mostly, temporarily shutting down plants and also allowing people to work from home. And on the lower left is a YouTube video that I'll put a link to. This is a German test kit that came out of Germany. And this is where we showed earlier in, people taking swabs of your mouth. Well, this is, a test kit where you can actually take a swab and put it in a little test tube, and it'll change colors to let you know whether that person's positive or not. So this is it does take a while for it to change colors, but you can take samples. This is a pretty fast test that you can run on a pretty large population. And this isn't being done in the United States. Why? Because we're just not smart enough. Then out of Spain went from 165 to 222. They're kind of creeping up there. Spain on the lower right, Spain reports its first coronavirus death. And another piece of news that this is maybe somewhat political. Spain refuses to close schools after 3 children test positive. There's different ways of looking at this. Children are not affected that much from coronavirus. There haven't been any deaths in children anywhere in the world. And children, when they do test positive, they often don't show any symptoms at all. That's the norm for children. They just are almost immune to this virus. So that's good, but the bad news about that is, you don't know which children have it. So put them together in a classroom, and they take it home and give it to mom and dad, and also school teachers and administrators. So there's different ways of looking at that, whether you should close schools or not. But, if the outbreak gets much worse in Spain, then yeah, you should close schools just like every other country. And then the U.S. So you can see here the U.S. went from 122 to 153, and you can see a map of the U.S. relative to other hotspots in the world. Of course, Asia is one big blob. Iran going west from there, and Europe. There's some countries that have some big issues in Europe, Italy being the biggest one. The U.S. looks pretty tame compared to most other areas. Then on this Johns Hopkins Global Tracker, if you click on the country on the left, you can see some details about that country. And 157 cases in the U.S. And if you look on the right, there are 11 deaths, 9 of them coming from King County, Washington. And then these two screen prints I left in there from yesterday because, you can't emphasize this enough. Responding to coronavirus testing problems, U.S. government expands the number of labs. Well, it's about time, but they waited for people to start dying before they did that. Now, what's crazy about this is the CDC, they must sit around at a table and smoke crack all day. I don't know what they do, but, they had not only test procedures that were way too stringent, hospitals still had to send their samples to Washington, D.C. I mean, how brain dead is that? How are you going to address people in Seattle that are near death, and 9 of them did die, and the first person died because the doctor couldn't get a test done because it didn't meet the CDC criteria, and they wouldn't take the blood sample. I mean, this is just insane. These people they seriously ought to be shot. So, and then if you click on any one of these hotspots in the U.S., the red circles, you can see the number of cases popping up there. So King County, 31 confirmed cases now, 9 deaths. 1 recovered. That was the first person in the United States, to be recovered. And then what else comes out of the U.S.? The House passed emergency spending. California governor declares a state of emergency after the first death in California. Top stories on the right. California reports first death, first presumptive case in New Jersey, and Texas confirmed case in Fort Bend County. So that's the big news stories coming out of the U.S. today. Then this is a coronavirus graph that you can enlarge. It's on the lower right hand side of the main Johns Hopkins tracker, but you can see on the left the scale is off. The scale is up to 85K. We're at 95K right now. They haven't fixed this graph, and it's totally worthless until somebody does something, because we don't really know what the trend is now. It looks pretty level if you look on the right side, but I doubt that it's level. It's more like the red line that I put in there. Okay, that's all we have for today. I appreciate your time.